Nothing drops blood sugar levels faster than this. Your normal fasting blood sugar test is lying to you. You can get a perfect score at the doctor's office while secretly suffering from what researchers call micro heart attacks in your blood vessels every time you eat. These rapid post-meal spikes generate toxic stress, inflame your arteries, and permanently exhaust your pancreas. Millions are silently damaging their bodies right now because they only track their morning numbers. If you want to drop blood sugar levels fast, you have to flatten those spikes. But be careful. People are currently using a viral internet blood sugar hack that is actually straining their heart and destroying their kidneys. I will reveal exactly what that dangerous trend is later in this video. But first, you have to understand how sugar gets trapped in your blood. Every single time you eat a meal with carbohydrates, your digestive system breaks that food down into glucose. That glucose pours directly into your bloodstream. Think of your bloodstream as a busy highway. The glucose is the traffic. Normally, your pancreas releases insulin to act as a traffic cop, directing that sugar out of the blood and into your cells. But if you have insulin resistance, that traffic cop is exhausted. The sugar has nowhere to go. It just piles up, causing a massive traffic jam. That is the spike. That is what damages your vessels. So, where is all that sugar supposed to go? Your skeletal muscle handles the vast majority of sugar disposal right after you eat a large meal. Your muscles are essentially a giant sugar sponge. When they pull glucose out of your blood, your numbers fall quickly and safely. But your muscles cannot just absorb sugar automatically. They use tiny transporters called GLUT4. Imagine your muscle cell is a massive garage, and GLUT4 is the garage door. When you are healthy, insulin signals the garage doors to open, and the sugar parks inside. If you are insulin resistant, those garage doors stay shut. The locks are rusted. The sugar stays on the highway, tearing up the pavement and creating a highly toxic environment inside your body. This is why fasting glucose fails to tell the whole story. Your fasting numbers might look fine in the morning because the traffic eventually cleared overnight. But for several hours after dinner, those closed garage doors forced your blood sugar to stay dangerously high, quietly causing permanent microvascular damage to your delicate arteries. Having more lean muscle means you naturally have a bigger garage. But a massive garage is completely useless if you do not know how to force those doors open when the locks are broken. Fortunately, your body has a hidden override switch. You can physically force those garage doors wide open, completely bypassing insulin, and drain the sugar out of your blood almost immediately, completely neutralizing the damage before it even has a chance to begin. That hidden override switch is muscle contraction. When you physically flex and contract your muscles by lifting weights or doing high-intensity intervals, you force those cellular garage doors to fly open. The brilliant part is that this pathway is completely independent of insulin. Even if your internal locks are totally rusted shut from years of metabolic damage, contracting your muscles acts as a master key. It physically grabs the glucose from your bloodstream and pulls it straight into the tissue. Clinical studies show that adding muscle contraction roughly doubles your overall glucose transport. You do not even need a gym to trigger this powerful mechanism. The most practical, hard-hitting tool you possess is simply walking right after you eat. When your gut breaks down a meal, it pumps sugar into your blood for 2 to 4 hours. If you just sit on the couch, that sugar causes a toxic traffic jam. But if you activate your leg muscles, they immediately act like a heavy-duty vacuum. Researchers at George Washington University put this exact concept to the test using continuous glucose monitors. They discovered that walking for just 15 minutes at a moderate, brisk pace, an intensity of 3 METs, where you can easily talk but cannot sing, slashes average daily blood sugar by 10 to 20%. The timing is absolutely everything. For maximum impact, you must start this walk within 30 minutes of finishing your plate. This brief, targeted movement is actually more effective at crushing the massive post-dinner glucose spike than doing a single 45-minute walk earlier in the day. You are actively draining the sugar sink right as it fills up. Every single step and every rep you perform drags glucose out of circulation, flattening the curve and shielding your delicate arteries from those microscopic heart attacks. You are literally walking the danger away. Using your muscles is the fastest way to clear sugar out of your blood once it is already there. But what if you could stop that massive surge of sugar from flooding your bloodstream in the first place? While physical movement quickly drains the sink, we can actually control how fast the faucet pours. By making one simple, invisible change to how you consume your meals, you can slash your next spike by nearly 30%. This method requires absolutely no calorie counting and zero extra effort. That invisible change is food sequencing. You do not need to restrict what you eat. You simply change the order. When you consume fiber and protein before touching carbohydrates, you create a physical shield inside your stomach. This slows down digestion, allowing glucose to seep into your blood gradually instead of crashing in all at once like a flood. A clinical trial at Weill Cornell proved this brilliantly. They discovered that eating vegetables and protein first and saving the bread for last resulted in a massive 29% drop in post-meal blood sugar spikes. It is the exact same food and the exact same calories, but the physical impact on your arteries is entirely different. You can combine this sequencing strategy with another highly effective, evidence-based tool, apple cider vinegar. The active component inside it is acetic acid. Acetic acid slows gastric emptying, meaning it physically delays how fast food leaves your stomach. A clinical trial from Lund University in Sweden showed that adding vinegar to a starchy meal slashed the immediate glucose and insulin responses by nearly 35%. However, medical safety always comes first. If you have gastroparesis, a condition where your stomach already empties too slowly, you must strictly avoid vinegar. It will only worsen your symptoms. Always make sure to dilute this acidic liquid in a large glass of water to fully protect your delicate throat and teeth from damage. If you are finding this information empowering and you are ready to take back control of your health today, type the word GREAT in the comments below. We are building a community dedicated to real healing, and your commitment inspires others who are struggling silently. Food sequencing and acetic acid act like a heavy-duty dam, controlling the flow of sugar into your bloodstream. But managing that daily flood is an exhausting, temporary game. To truly protect your blood vessels from micro heart attacks permanently, you cannot just manage the flow. You need to build a permanent, heavy-duty metabolic engine that burns sugar around the clock, even when you are sleeping. That permanent engine is your skeletal muscle. Every ounce of lean muscle you carry acts as a biological storage tank for glucose. As we age, we naturally lose muscle mass. This condition is called sarcopenia, and it shrinks your storage tank every single year. The less muscle you have, the higher your blood sugar spikes, even if you never change your diet. You must reverse this decay. Resistance training 2 to 3 times a week is not just for bodybuilders. It is mandatory metabolic maintenance. Clinical reviews confirm that lifting weights repeatedly activates those cellular garage doors during your workout. More importantly, it permanently increases the total number of GLUT4 transporters in your body. Observational studies consistently prove that people with higher muscle mass and strength dramatically lower their risk of type 2 diabetes because their bodies become highly sensitive to insulin between workouts. But building the engine is only half the equation. You must also supply the spark plugs. Your body requires a specific biological cofactor to make insulin function properly, and millions of people are completely deficient in it. That missing link is magnesium. Magnesium physically binds to your insulin receptors, allowing the hormone to signal those garage doors to open. When you lack magnesium, your cells become deaf to insulin. The sugar just sits in your blood, destroying your arteries. Large epidemiological studies show that people with the highest dietary magnesium intake cut their risk of developing diabetes by a massive 10 to 30% compared to those with the lowest intake. Replenishing this vital mineral restores the cellular communication pathway, making your natural insulin highly effective again. You are literally repairing the broken locks from the inside out. Building muscle and restoring essential minerals rebuilds your foundation. You are permanently fixing the core machinery that easily handles sugar. But what if the damage is already severe? What if you need something stronger to force a metabolic shift right now? To rapidly tackle deeply rooted insulin resistance, we must look beyond basic minerals and introduce targeted, heavy-hitting botanical compounds that rival the power of prescription medications. That heavy-hitting botanical compound is berberine. It is currently flooding the internet, with influencers calling it nature's metformin. But I'll give you the absolute truth, not the hype. Both berberine and prescription metformin work by activating an enzyme called AMPK, which stops your liver from pumping excess glucose into your blood. A recent systematic review analyzed patients taking either berberine or metformin. The results showed no statistically significant difference in their blood sugar drops. Furthermore, combining the two lowered post-meal spikes by an additional 34 milligrams per deciliter. However, we must treat this with strict medical caution. Most of these trials were small and conducted outside major Western medical centers. Berberine is a powerful tool, but it is strictly an experimental addition, not a medical replacement. If chronic high glucose has already damaged your nerves, causing tingling or burning in your hands and feet, another intervention becomes critical. Alpha-lipoic acid, or ALA, is a highly potent antioxidant. It specifically targets the severe oxidative stress destroying your nerve endings. In a rigorous multi-center clinical trial known as Aladdin 3, researchers tested ALA on over 500 patients suffering from diabetic neuropathy. The results were striking. Another randomized trial using 1,200 milligrams of oral ALA daily showed that 50% of patients experienced massive symptom relief in just 4 weeks, compared to only 18% on a placebo. It physically restores nerve blood flow. But here is the most critical warning. You cannot blindly mix these compounds. If you stack concentrated berberine or high-dose ALA with prescription medications like insulin or sulfonylureas without strict doctor supervision, you risk severe hypoglycemia. You could literally crash your blood sugar to dangerous, fatal levels. Supplements are not candy. More importantly, swallowing the perfect, scientifically backed supplement stack is completely useless if you are actively sabotaging your body behind the scenes. You can take all the berberine and ALA in the world, but your blood sugar will remain completely out of control if you ignore the invisible, daily lifestyle saboteurs silently destroying your delicate insulin sensitivity. The most aggressive invisible saboteur destroying your insulin sensitivity is a lack of deep, restorative sleep. You can perfectly sequence your meals and lift heavy weights, but if you are chronically exhausted, you are fighting a losing battle. In a deeply alarming controlled laboratory study from 2010, researchers took completely healthy young men and strictly restricted them to just 5 hours of sleep per night. In only 1 week, their insulin sensitivity dropped significantly. Without changing a single calorie on their daily plates, their bodies rapidly started acting pre-diabetic in exactly 7 days. This happens because sleep deprivation and chronic mental stress flood your system with cortisol. Cortisol is your primary survival hormone. When it stays elevated every evening, it actively blocks the insulin receptors on your cells. It makes your body completely deaf to the signals trying to clear sugar from your blood. Worse, high cortisol actively pushes extra fat directly into your liver and deeply around your organs. This visceral fat acts like a toxic factory, constantly releasing inflammatory chemicals that lock your cellular garage doors shut. Over time, this vicious cycle dramatically raises your fasting glucose and expands your waistline, even if you eat a spotless diet. Your metabolism simply cannot function in a constant state of emergency. Sleep apnea and chronic sleep disruption are heavily tied to visceral obesity, entirely independent of your body weight. You must target 7 to 8 hours of quality rest and actively manage your daily stress to restore true metabolic flexibility. When people do everything right with their food but still see their morning numbers climbing, they feel completely helpless. They do not realize that stress and poor sleep are the hidden culprits. This deep frustration naturally makes them desperate for a quick fix. That desperation is exactly what drives millions of people to experiment with extreme, unproven, and highly dangerous internet trends that promise a miracle cure. But as we are about to see, these viral hacks are not just useless. They are physically destroying the exact vital organs that you are desperately trying to save today. In the very first minute of this specific video, I promise to expose the dangerous viral internet hacks that are silently destroying many people's kidneys and straining their hearts. When desperation hits, people turn to extreme trends like dry fasting. Dry fasting means consuming absolutely no food and zero water. Proponents claim it resets your body, but physiologically, this is a disaster. It rapidly concentrates your blood, making it incredibly thick. This forces your kidneys to work in overdrive while completely dehydrated. Major organizations like the American Diabetes Association and the European Association for the Study of Diabetes explicitly warn against this. There is absolutely no high-quality clinical trial proving that dry fasting lowers your blood sugar safely. Instead, dehydration aggressively spikes your cortisol and glucagon hormones, which actually forces your blood sugar even higher. The second dangerous trend spreading online is drinking salt water to supposedly balance blood sugar. Let me be perfectly clear about this. Salt water does absolutely nothing to soak up excess glucose. There is zero physiological mechanism for this. What it actually does is drastically increase your sodium intake. Hypertension guidelines in the United States and Europe uniformly demand limiting sodium to under 2.3 grams daily to prevent cardiovascular events. Pounding salt water aggressively pushes up your blood pressure. It puts a massive, dangerous workload directly onto your heart and kidneys. You are literally triggering the exact vascular damage you are trying to prevent. Finally, we must talk about supplement stacking. Earlier, we discussed powerful tools like berberine, magnesium, and alpha-lipoic acid. But combining multiple glucose-lowering agents is incredibly dangerous. If you stack these heavy-hitting supplements on top of prescription medications like insulin, metformin, or sulfonylureas without strict medical monitoring, you create an additive effect. This is exactly how people suffer severe hypoglycemia. You can easily crash your blood sugar down to 40, causing you to pass out on the floor. In medical studies, these supplements are carefully controlled, not recklessly stacked together. Real, lasting metabolic healing does not come from following dangerous internet extremes or entirely starving yourself of water. Supplements and viral hacks are not magic pills. It comes from a calculated, deeply consistent approach to your daily physiology. Now that we have eliminated the chaos and the bad advice, it is time to map out the exact, proven master plan you will use every single day. The true master plan is not a secret internet hack. It is a relentless, daily biological rhythm. Every single day, you must sequence your meals. Eat your fiber and protein first, saving the carbohydrates for last, to instantly slash that dangerous glucose spike by nearly 30%. Within 30 minutes of finishing your plate, take a brisk walk for exactly 15 minutes. This simple, highly effective habit actively drains the sugar sink and drops your overall daily glucose by 20%. Protect your permanent metabolic engine by lifting weights 2 to 3 times a week. This physically forces those cellular garage doors open and reverses the muscle loss that naturally slows your metabolism. Finally, defend your rest like your life depends on it. Secure 7 to 8 solid hours of sleep every single night to stop toxic cortisol from aggressively locking your cells shut. Consistent, daily physiological habits will always beat temporary extremes and dangerous starvation diets. You now possess the exact clinical blueprint required to shield your delicate arteries, lower your numbers safely, and permanently restore your metabolic flexibility. If you found this medical truth genuinely valuable, please share this video with someone you love who is silently struggling with their health. We are entirely focused on providing real solutions, stopping dangerous misinformation, and saving lives. Take back control, and I'll see you in the next video.